Case study research has the potential to successfully capture dynamic interactions between context and implementation of complex healthcare interventions, conducting in-depth investigations of the particularities of phenomena within context. However, what is meant by context and how it is investigated often lacks precision, potentially limiting the explanatory power of the findings beyond the specific case under investigation. The CCC study is funded by the Medical Research Council to develop guidance on the conduct and reporting of case study research into the influence of context on complex healthcare interventions, involving a meta-narrative literature review, a Delphi expert panel, and interviews with case study researchers. This poster focuses on findings from the meta-narrative review of empirical case study health research, focusing on how context was conceptualized and then operationalized. We identified 5 meta-narratives which represent different ways health researchers engaged with case study as a methodology. Despite these differences, we found some common difficulties in how context was conceptualized and operationalized. These difficulties oriented to how researchers define context, with context either not being clearly defined or as a setting or factors, limiting insight into how the actors involved in delivering the intervention actually enacted context. Or they lacked explicit connection to theory, potentially limiting wider transferability. Secondly was how researchers translated definitions of context into methods. Data collection often involved taking snapshots of implementation, limiting insight into dynamic interactions over time. Context mechanism outcome interactions were observed indirectly, such as relying on interview methods alone. Or there was a use of frameworks which presupposed a definition of context prior to investigation. Thirdly was how context was analysed. Concepts of context were often ontologically incoherent, making it difficult to connect and identify the influence of different contextual features. Analysis often provided limited insight into wider structural and historical forces shaping implementation, or involved an analytical process which functioned to limit insight into dynamic relations, for example, focusing on contextual characteristics as separate entities within organizations. These difficulties had consequences for knowledge production. Studies frequently produced a list of conditions as steady states, rather than dynamic interactions over time. And authors placed limitations on the explanatory power of case study findings, offering their results as points of transferability rather than stronger claims to theoretical generalizability. These findings show that case study research could be enhanced by more careful consideration of how definitions of context are translated into methods and analysis, and the consequences this has for findings they produce. To do this, researchers might benefit from drawing on case study research across a wider range of disciplines, which might facilitate deeper engagement in how context has been understood and investigated.